And then first start bugging you?
Oh, my neck after I had a bad wreck. I had a TBI.
In 15?
Yeah.
But before that, did you ever have any neck pain or anything?
Not really with the neck, but I was stopped at a stop sign and I got T-boned by a girl doing 65. So, I mean, I got whacked pretty good.
You bet.
I think they said L5. It's right at the very base. And the first time I experienced that was probably 10, 15 years ago. And not really doing anything. Everything hurt. Sitting hurt, sleeping hurt, going to the bathroom hurt. Pretty miserable. I've had that a couple of times since. Sometimes lower back pain when I'm sitting in the car. Change of getting up from sitting down, got a little bit of dizziness. I started looking and investigating things more, and it could be something to do with my neck as well.
Got it.
And I was told that disc was chipped in the wreck.
In that moment, I know it was fast. Do you remember what happened? With you physically, like kind of what your
head went this way, came back this way, and hit the post. It snapped hard, and my doctor 2 days later, because I still had a headache, and they sent me for an MRI and found it was a contracture injury. Actually, is what it was diagnosed.
I'll have you come sit on the end of the table.
Okay, sure.
I'm going to check out your posture.
Okay.
Overall first.
Okay.
And I'll take a look at your neck. Right in there.
Yep, I can feel it on the right side.
It's a C2 dorsal root. It'll inflame every time. And then after I adjust somebody, it just melts when I get a good set.
Oh, nice.
It's a little check engine light for me. Sit up straight. Get a right hip tilt. Your whole right side's pretty hypercontracted. Can you feel that? Yeah. You understand when the head and neck are out of proper alignment, the body will hypercontract on that side. Cool. For you, I see it on the right. I just think you've been kind of keeping your demons at bay.
Yeah.
Keep it moving, man.
Well, absolutely. For me, when I don't move, that's the worst thing in the world.
You'd be in a lot worse shape otherwise. If you're game, you can grab your stuff and I'll head back. What you'll notice is
They're sticking out.
So a couple things. You should have a more normal height.
Okay.
So here you see how this is a little fatter, more plump.
Yeah.
Right?
Yeah, and then not as they go down, the bottom one has no cushion.
It's tighter.
Right.
Okay. The other is how flat the front of this bone is.
Right.
And then how sharp you can see the line of the edge of it.
Okay. And the other ones you really can't.
And then on these, you'll just notice it starts to lip out here. You'll hear lipping and spurring. Okay. You'll notice that lip there in the front.
Right.
The atlas is actually this little bow tie here.
Wow.
So we'll measure the plane of it relative to your skull.
Cool.
Also how C2 is rotated. You can see it's a little rotated there relative. And then this is from the top down. The atlas actually is a little ring in that pocket between the base of your skull and jawline. So I'll measure how that's rotated relative to the skull as well. And that'll give me basically a blueprint, composite of numbers for how to influence your head and cervical spine and influence that joint to where it will release with the sound wave. Cool. So everything is heading back to where it was before it got knocked around. We're going to be influencing to take that rotation out of C2 by taking it more towards the right. Okay. That's probably your biggest factor is the rotation on your C2. It's really rotated left. Atlas is also really rotated left anterior as well. Okay. So the other big component is how hard, I think you can see it visibly, the cervical spine is tilted as well. My work will focus on repositioning that head and neck and then releasing the atlas into normal position. You holding that alignment for as long as possible is the power in what I do. Right. So my goal is to do this as infrequently as possible and for you to hold it for as long as possible. Okay. Okay? Yep. Any questions? Nope.
How are you feeling? Oh, not bad. I'm a little dizzy. Pretty good, actually. I can feel a little tightness like in there.
A little guarding.
It doesn't hurt on that right side though when you press.
Exactly. So that nerve root's no longer swollen.
Wow.
So the atlas is properly positioned again underneath the skull.
Huh.
Cool, right?
Yeah, it's pretty cool.
And then your leg check looked good too. So your body's been released out of that.
Cool.
How's the body behaving?
Kind of not bad.
Not bad?
Yeah, no.
What are you noticing overall?
Did I feel better?
Give me some specifics. Or is it just a general sense?
No, my neck doesn't hurt when I turn it. I mean, I'm definitely feeling better.
Nice.
Yeah, Friday and Saturday were great. I've been walking like 5-6 miles a day. I mean, I'm just feeling pretty good.
You're gonna live forever.
I hope so.